Menopause Energized 30-day Healthy Heart Marathon. Day 2.
Hey everyone, welcome back to the Healthy Heart Marathon. And this is day 2. And again, I'm Sheila, and I am a registered nurse and health coach and the founder of the program Menopause Energized. So, yesterday on day 1, you guys, we started the foundation. And the foundation was to learn about, and I'll turn it real quickly just to show you what we talked about for those that missed it. We talked about the heart. We have to educate ourselves first on the heart and how it works in order to understand everything else going forward. So basically, that's what we talked about yesterday, and I wanted to make sure, I always try to make sure that each day we teach is something that you can take away today and start today to get a more healthier heart. And so this is what we talked about yesterday, and I was able to squeeze in the signs and symptoms of a heart attack and when you should seek attention. Today, day 2, I felt it was appropriate to talk about the estrogen level because the estrogen level, when it declines, gives us that risk of heart disease. As you remember, as I said yesterday, cardiovascular disease is the number 1 killer in women. And the estrogen protects your heart, but then menopause changes everything. And so I wanted to go in a little bit today about the estrogen level. And the main thing I want you to take away is what you can start doing today as far as protecting your heart. So today we already reviewed what we did yesterday a little bit. I do want to tell you a little bit what some of you may already know about the estrogen. As you guys know, or maybe some of you all know, maybe some don't, we have estrogen in our body. Where it is produced is in the ovarian follicles of the ovaries. We do have other parts of the bodies that produce estrogen, like the adrenal glands, but the ovary follicles are the main producers of of the estrogen production. When our eggs start to die down in the ovaries, the estrogen dies down with it. And unfortunately, when that estrogen dies down, we are more at risk for heart disease, which I'll explain to you in just a few minutes. Now, some people will say that we may, and I think I mentioned this yesterday, you'll hear saying that we're at war with our hormones. I really don't see it that way because the estrogen is actually leaving us. We need that estrogen to come back and protect us, but it's actually leaving us. Maybe if anything, we're in a battle with these symptoms that we have from estrogen, but we're not really in a battle with the hormones because they're leaving. So you don't fight for something that's leaving you, something that's coming towards you as a risk, then you feel like you're at war. But estrogen is leaving. It does not leave completely again. We still have some that is produced by the adrenal glands and a couple of other organs in the body. Don't forget to, you just don't hear it much, progesterone and testosterone is also affected as well. We just don't produce as much of it. So I have some notes up here for myself. Hopefully you can see it, but they're mainly for me. So let's talk about the important function of the estrogen. Number 1, estrogen supports our cholesterol. It helps to lower the bad cholesterol, which is the LDL. We'll get more into that later. I had promised you I'm not going to keep you here an hour or anything like this. This should last about 5 or 10 minutes, and that's it. I try to just take little segments each day for 30 days. And then estrogen protects the HDL, which is the good cholesterol, so it helps to regulate that. So you see what happens when the estrogen starts to decrease. There's a risk that our cholesterol level could go up, which puts us at risk for heart disease, because when you have high cholesterol level, you develop plaque in the arteries. Again, like I said yesterday, could break off and travel to one of the vital organs of the body, cut off oxygen and blood cell supply, which sometimes can give you symptoms of, if it's the shortness of breath or having some chest pain, and the worst that we never want to see happen is a heart attack. Let's see, it also helps to regulate blood pressure because it keeps the vessels our arteries and vessels. It keeps it open and flexible. Once the estrogen leaves, it kind of gets stiff and collapses a little. That builds up pressure. And so that's why we also have a risk of high blood pressure when the estrogen level drops. The other thing that leads to that, well, you see here I have increased risk, which leads to the heart. I'm not a real good artist, never have been. I cannot draw worth a lick, but this is the best I could do as far as the heart. Now, there's other things as well that can affect that, but right now we're talking about the heart because the whole thing is estrogen can affect so many more things. I will go into that more. I have an 8-week coaching program coming soon, and we go into all of that. We don't go into it here, but estrogen has so many other effects on your body. But like I said, we're going to stick to the heart health for the next the next 29 days. Now, this is the thing. There's stuff that adds to that. I tell you, that's why what I'm trying to explain to you, we really need to start modifying and changing our lifestyle when we get into the menopausal years. We probably should have been doing it all along, but if any time more than ever, you guys, it's in your, really start with your perimenopause, because the changes can start happening in the perimenopause phase, which is usually about 30s, 40s, where women starts to get some type of symptoms, hot flashes, mood swings. They can pretty much get some of the same symptoms in your menopause phase, but again, not everybody experiences that. Again, like I said yesterday, if you have a girlfriend of yours that may be having a few of these symptoms and you tell her, oh, you must be in that perimenopause phase, get ready to go on menopause, trust me, they don't want to hear that. And then we have factors that add to this, unfortunately, risk of heart disease is your lifestyle, weight gain, smoking, stress, and of course your nutritional habits. All of that affects it. We'll get into that later down the road in this 30-day healthy heart challenge. Now, I don't get into, if you can see this, hormone medications, medications you can take for your hormone levels when the estrogen drops, because it's too controversial. And because it's so controversial, and you're going to hear somebody on one end say it's good for you, someone on the other end say it's not good for you, I don't get into that. I did myself try it just for a few months when I started my menopause years ago, but I did not stay on it long. That was just my personal reason for not staying on it. And you should always discuss with your physician. If you're even thinking about something like that, you need to sit down, discuss it thoroughly with your physician. Always research it yourself before you go in with the doctor, and then you have to decide your doctor what the best treatment would be. If you're really having really bad symptoms and you're suffering with the hot flashes and the mood swings and a lot of other things that come with that. And so my main goal today for you to get out of this particular session is what you need to do so that you can decrease your risk of heart disease, and maybe even if there are some symptoms going that you for risk, you can catch it early. And the way to do that, and I know some of you say you may know this, but I'm telling you, I talk to a lot of women and even men when I coach men and women back in the day. They just don't know. They don't go to the doctor, and when they go to the doctor, it's too late. And before I get into this, I'll give you an example. I had to talk to patients when I was doing health coaching and case management, and like I would call them. They hadn't been to doctors in years. When I asked about the medications, they say they don't know what medications they take. They just take it. Unfortunately, the bad part about it is that over the years, if you let things go and you don't know what's going on with your body, and when you finally decide 5, 6, 8 years down the road, okay, I think I'm going to just go ahead and go into the doctor and get checked. Now, don't get me wrong. Some are lucky. Some will go in, healthiest person in the world. You wonder sometimes how people stay so healthy when they really didn't take care of themselves. But that is the case. But then there's some that comes in and their numbers are way out of control. This is the problem. Sometimes those numbers are out of control for years. Let's take, for example, diabetes or high blood pressure. Everybody do not have symptoms of high blood pressure. That's why it's called a silent killer. because sometimes when it happens over a certain amount of years, now I will say some people may have some symptoms and just don't say anything, or really at the time had them and didn't know what to make of those symptoms and just kind of brushed it off. That's the most dangerous thing you can do. But when they finally get into the doctor's office, I'm gonna just take a good example, diabetes. Their numbers is way off the chart. Well, guess what? By that time, it has already done its damage. It has already given you neuropathy. It has already affected your kidneys and you have kidney failure. So the point I'm trying to make is what I'm getting to now. You need to have your health screenings up to date. And for some of you that's on here, if you've never really been up to date, you need to keep your physical annual appointments with your doctor. It is so important because if there's something going on, that's with anything in a physical condition, if they catch it early, it can be treated to decrease your level of having serious symptoms from cardiovascular disease. So you need to get, and the reason why you need your physicals, of course, you're going to need your blood work checked to make sure your numbers are okay. You want your blood pressure checked to make sure your blood pressure is okay. I would tell everybody, I think every woman, and there may be some women out here really healthy, don't have any problem with their blood pressure. Right now, I'm talking to the women on here, and maybe that's who the women are that needs that extra coaching. And you're going through your menopause years, and you may have high blood pressure right now. The doctor may say you're borderline. I think every woman in that case should have a blood pressure machine in their house. Now, I know that everybody's not going to know how to take your blood pressure manually, but at least get the electronic one in. They're not really that expensive. You can get an inexpensive one. It is good to invest in a good quality one. And no one says take your blood pressure all the time, but you should keep one in the house. Because one thing you don't want to do when you start using these tools like your blood pressure machine and your sugar machine, for those that do not really have blood pressure, you don't want those machines to control your life. You don't want to be running into to grab your machine every time you feel something, every 10, 15 minutes, oh, it may be my blood pressure. You have to learn how to balance that out. And so you want to get your blood pressure checked, you want to get your glucose checked, and you want to get your cholesterol checked. Because you want to know early if there's anything off, you can start normalizing those levels now. And then your doctor and you will collaborate as a partnership and decide what to do. Let's see. And then also, believe it or not, dentists every 6 months to a year. I know people say that's crazy, but it is important. When you don't have good mouth care, or if you think you're doing good mouth care, bacteria can break. Believe it or not, bacteria can break into the bloodstream. And sometimes it can affect the heart. I have taken care of patients that have had endocarditis, which is an infection of the heart from a tooth abscess. I had one patient that wound up in ICU in a coma from just the abscess of his tooth. I'm not saying that's what can happen. I'm not diagnosing anything. I'm just saying it is important that you get your dentist checkup and get your teeth cleaned every 6 months to a year. And then also, it also causes, as far as the estrogen, because the estrogen, like I said, keeps the vessels everywhere in the body open and flexible. And so when you don't have that estrogen there, you have, again, more chances of getting that inflammation in the arteries. OBGYN doctor. You should definitely keep up with your OBGYN doctor once a year, even if you've had your hysterectomy and your ovaries removed. Because if you're going through a bad time of menopause symptoms, hot flashes, mood swings, whatever it may be, there's 100 and some symptoms that can occur from being in menopause. Of course, we won't go into that now, and I just went into the few, I believe, the other day. Might have been yesterday, maybe, on one of my other coaching videos. But the OBGYN doctor, she can discuss with you what your plan of care is. She will be more able to discuss with you what your plan of care is for your menopause symptoms more than your regular primary doctor. And there's also tests that they do now, blood tests, to check your levels. One of them is called, a follicle stimulating hormone. If that's elevated in your blood, when the results come back, it means that there's a decrease of estrogen production. So the FSH would be high, which means that your estrogen level is really low. And so then your doctors can kind of tell you you're probably in that menopausal phase. And there's a mechanism, the way that works. I won't go into it too much here, but it's the FSH is working hard, really hard to keep up with that estrogen production, but it's not working. And they're going to keep producing more and more and more. And that's when that FSH level goes up. And then, believe it or not, ophthalmologists, you should see an ophthalmologist once a year as well, because the estrogen level is affecting all these. And then you do have high blood pressure and diabetes from your estrogen level being low and the risk for everything going up. The hypertension and the diabetes can affect the arteries in your eyes. And we all know this. I shouldn't even have to mention this. There are people that can go blind from glaucoma due to the effect of the arteries in the eye. So you should keep up absolutely with an ophthalmologist once a year. Now, this may not necessarily have to do with heart, but I wanted to bring a couple of these in here anyway, since we're talking about checkups. So I just felt like it was still appropriate. Osteoporosis. Estrogen keeps our bones strong, ladies. And when the estrogen decreases, we lose bone mass and the bones get brittle. And some of us will have osteoporosis and don't even know it until we fall. We don't think we had a big fall, but for whatever reason, when we fell, we broke our hip or whatever part of the body that was affected when we fell. So getting what we call I think I have it here somewhere, bone density test. Your doctor will tell you if you need it every 2 years, every 5, probably every 2, depending on what your results come back. I won't get into that because the results of that is really fine. It talks about the T levels and this level, if it's high here, low there, really confusing. We won't go into that. All I know is that since I'm including all these, and I know it sounds like a lot, it sounds like you're going to be in the doctor all year round because you got your primary doctor, you got your dentist, you got your OB/GYN, you got your ophthalmologist, and then you got to go get that bone density scan. But yes, the doctors do recommend you have that as well. There are patients sometimes that are put on medication. We won't go into that, but the doctor mostly would tell you move, move, move. The more you sit, if you have a sit-down job, the more risk you are for getting osteoporosis because you're not moving those bones. And then let's see here. This is another one where it really doesn't have to do with heart. Here we go again. And I'm going to tell you, to be honest with you, I have a hard time keeping up with all this every year. What I try to do is just kind of schedule everything at once. So I go for all of these and I try to put it in that 2-month period, time frame. But I'm going to admit, it's a lot. But when you think about, protecting your health, it's important. So again, the mammogram may not have anything to do with heart disease, but it has to do with the estrogen, kind of. And the reason why I say that, estrogen stimulates growth in your breast tissue. So, believe it or not, this sounds strange. Our breast is exposed to estrogen over the years. I'm not really talking about stuff from the outside. I'm talking about from the estrogen we produce inside our body before it drops. Our breast is exposed to that. And so with that being said, this is why women are always have to be careful and get a mammogram to watch out for breast cancer. Because not that estrogen can cause breast cancer per se, but it is kind of like a culprit because your breast is exposed to the estrogen that you produce, which later on you have to be careful because there's always a possibility in any woman, no matter what your risk factor is, you always have to be careful that you do not get breast cancer. Now, there are some women that are more at risk than the other. due to hereditary, and there's a certain gene, hereditary gene, that the doctors are testing now that they find women are at risk. So we always want to keep up with our mammograms. Like I said, it has nothing to do with the heart, but since I'm telling you about all the stuff you should get through the year, the mammogram is one too, and it's once a year. And I've talked to some women that won't get that as well, talking about they don't want to deal with the pain. Everybody has a different threshold with pain, but I can't understand this one. Maybe you guys can comment down there and tell me. It's just uncomfortable. That's all. Nobody breast likes to be squeezed. It feels uncomfortable, but it's not pain. I try to use a mindset that when I'm getting my mammogram done, I sit there, instead of me thinking about being uncomfortable, I'm sitting here saying this test could save my life. And just a little tidbit of information. The reason, we may already know this, why women are more at risk than breast cancer than men, because men doesn't produce, of course, estrogen like we do. There are cases, a small percentage of men that do get breast cancer. I had a neighbor that was a male that had breast cancer and died from complications of breast cancer. It's very small, but it can happen. But they produce some estrogen. It's really small amount. You know, theirs is usually the testosterone. And we, of course, have the testosterone as too, but we had the testosterone in a small amount. They have it in a big amount. But yes, that's the reason why you don't hear breast cancer in men like it is in women. And you guys may have already known that. And so basically, that's what I wanted to tell you in this segment. And yeah, that's all I have. So the main goal for this segment is to let you know to get all these tests here are necessary in order to keep up with your health and hopefully cut down on your risk of cardiovascular disease. Now, tomorrow, I felt like also appropriate, this will lead into know your numbers. I'm going to discuss your numbers that you should know when you go to the doctor's office. A lot of people will go, they have no idea. I'm telling you, knowledge is everything. Because when you know what your numbers are, you know what things are looking like, you're in better control to help improve your health. Matter of fact, to me, you're even more motivated. Because when the doctor tells you this is your numbers, and a lot of times the doctors will tell you it's your numbers, but you forget it by the time you get home. You take your notepad to the doctor's office, and when she gives you those numbers, you write it down. And even if she don't give you what the normal values are, which I'm saying she because my doctor is a female, but he or she ask for the numbers at that time. If not, go research, know what your numbers are, but I'm going to give you those numbers tomorrow so you will know. When you go to the doctor, you'll know your normal blood pressure range, which we already talked about yesterday, what your cholesterol number should be, what your blood sugar number should be, and also something called, I think it's HbA1c. It tests your blood sugar in your bloodstream for 3 months. That's a more predictable measurement of diabetes than the actual fasting blood sugar. And it's going to be 5 or 10 minutes tomorrow. We'll take of that. So I felt was appropriate. I want to try to have everything flow to the next. So tomorrow will be know your numbers. And until then, take care.